This is oral medications. So the first thing I'm going to do is I'm going to check my patient's chart. I'm going to look at the physician's orders on the EMR and see what my patient, Marco Kemp, needs right now. So I see that he needs prednisone and warfarin. So he needs the prednisone 20 milligrams BID twice a day orally. And I see that he needs the warfarin sodium 5 milligrams daily on the oral route. I'm going to look at his allergies. He is allergic to hydroxychloroquine, and his pertinent lab and assessment data do not contraindicate this medication administration. So now I'm going to do my med math. So for the first medication, prednisone, it's dispensed as a tablet with each tablet containing 20 milligrams. His dose is 20 milligrams. So I'm going to give him 1 tablet of prednisone. Now for his warfarin, it's dispensed as for every 1 tablet. There's 5 milligrams of warfarin sodium. So I'm going to give him 1 tablet because his order is 5 milligrams. Okay, I'm going to wash my hands, unlock the medication cart, and retrieve my medication. Warfarin and prednisone. So I'm going to check the warfarin first. I'm going to compare this with the EMR. So this is 5 milligrams, is not expired, and this is the oral route of warfarin sodium. Now my prednisone is, this is an oral tablet, it's not expired, and this is 20 milligrams. This is actually open and go back. Waste this one. This is being put in the waste. So I'm going to check the prednisone again. So we have the 20 milligrams for 1 tablet. This is not expired. And this is the oral route. And this is the prednisone. Okay. I'm going to grab my supplies. I'm going to lock my medication cart and head on over to the bedside. Okay. Hello, I'm Amanda. I'm going to be your student nurse. I'm going to wash my hands. Can you please tell me your name and date of birth? Marco Kemp, 919, 19XX. Okay. Are you allergic to anything? Cytolyloxine? Okay. I'm going to pull the current. You're allergic to hydroxychloroquine. So, Marco, your physician has ordered you 2 medications. They're oral tablets. The first one is prednisone. The purpose of this medication is just going to help combat your allergies and your inflammation. And your second medication is warfarin sodium. This is going to help prevent blood clots and prevent emergencies like CVA, MI, pulmonary embolism, all of that stuff from happening. Do you have any questions? No? Okay. So now I'm going to do my specific assessment. So for first prednisone, I'm going to take his temperature. I do see that he's running a fever. He has the allergies. He's coughing. So that's an indication that he needs his prednisone to prevent make the fever go down, prevent his coughing. I'm now going to check his blood pressure for the prednisone, since the adverse effect of that is hypertension. I checked it. He is not hypertensive, so he's good to go and have his prednisone. Now I'm going to check his look at the warfarin sodium. So he's doesn't have any major life-threatening bleeding. Do you have any dark, bloody, tarry stools? No? Okay, so he's not bleeding anywhere, so that is a good indication that I can still give this medication. So an adverse effect of prednisone is going to be hypertension, and chest pain and a headache. So please press your call and let me know if you have any of those. And an adverse effect of warfarin is dizziness and a headache. So like I said again, please press your call light and let me know. The purpose of prednisone, like I said, is going to help with your allergies and inflammation. I would assess like his respiratory status. I'll see if he's breathing appropriately, if he's not congested. I'll see if his temperature went down. And I will also, for warfarin sodium, I will assess to see if if he doesn't have signs of like an MI, a CVA, or a stroke. See if that blood thinner is the right dose for him to prevent those emergencies from happening. Okay. Now I am going to scan him. Okay, so I see his chart is pulled up. Now I'm going to scan his first medication, which is the warfarin. Okay, so the warfarin, I'm going to do my six rights of medication administration. So for the warfarin, sodium, it's the right patient, which is Marco Kemp, the right drug, which is warfarin sodium, the right dose, which is 5 milligrams, the right frequency, which is daily, the right route, which is orally, and the right reason is to prevent blood clots from causing an emergency and to thin out his blood. Now I am going to scan in his prednisone. Okay, so his prednisone has scanned in. I'm going to do the 6 rights of medication administration with prednisone. So the right patient is Marco Kemp. The right drug is prednisone. The right dose is 20 milligrams. The right frequency is twice a day. The right route, which is orally. The right reason is to help with his allergies and inflammation. Okay. Now I'm going to make sure my patient is in a high Fowler's position. I am going to wash my hands. Don some gloves. I'm going to see if my patient can swallow effectively. Can you swallow 2 pills at a time? Yeah. Okay. Can you swallow this water? Okay. So he can swallow the water. He didn't aspirate. He's not coughing. So he can have 2 pills. Now I'm going to sterilely pop the prednisone into here. Now I'm going to sterilely pop the warfarin in here. Okay. Now I'm going to do my 6 rights of medication administration again. So you have the prednisone. So you have the right patient, which is Marco Kemp. The right drug, which is prednisone. The right dose is 20 milligrams. The right frequency is twice a day. The right route is orally. And the right reason is to help prevent his allergies and inflammation. Now I'm going to do my warfarin sodium. So we have the right patient, which is Marco Kemp, the right drug, which is warfarin sodium, the right route, which is orally, the right dose is 5 milligrams, the right time is which is once daily. The right reason is to prevent blood clots and emergencies associated with those. Okay. My patient is in a high Fowler's position. I'm going to take off my gloves and wash my hands. Okay. So I have your prednisone and warfarin. Okay. Like I said, these are just tablets that you're going to swallow. Here you go. He swallowed those. I'm going to offer you some water. Here you go. Did you get those down okay? Can I look inside your mouth? Okay. You got those down okay? I am now going to dispose of all of this. I'm going to wash my hands. I'm going to make sure that he's in a safer position. Here's your call light. Are you comfortable where you're at? Yeah? Okay. I will assess him in around an hour. I am going to look for like decreased signs of inflammation and infection, so like less congestion, a decreased temperature. I'm going to reassess him also for the hypertension, for that being the adverse effect of prednisone. And for warfarin, I'm going to assess him for bloody stools, bleeding out, for the adverse effects. And for like the therapeutic effect of warfarin, I'm going to check to see if he is developing an MI. I'm going to look at his labs to see if he has an increased thrombin, and see if the warfarin is doing what it needs to do. So now I am going to document what I did. So I gave prednisone 20 milligrams orally, 2-28-2025 at 11. Location, he did orally. Pertinent clinical assessment data, he was not hypertensive, so I'm going to put his blood pressure 120/80, and he had some congestion and a fever. I have a nurse witness signature, and I'm going to chart that. And for warfarin sodium, I am going to chart that he was given the warfarin sodium orally, 2-28-2025 at 11. The dose was 5 milligrams. I gave him that orally. Pertinent clinical assessment data, he did not have any signs of bleeding, so he didn't have bloody stools, and he didn't have life-threatening like bleeding, like lacerations or anything. I'm going to have a nurse witness signature, and yeah, I'm going to chart that, and my skill is done.